So welcome back to another virtual walk with a doc. I'm Dr. Martin, and I'm going to be your moderator today. For our November talk, we have an important topic that almost 500,000 Americans suffer from, which is hypertension. And with 1/4 of those Americans not being well controlled, we thought this would be a great topic to talk about with our featured doc and future doc today. Today we have Dr. Anil Kaparapu. He is an esteemed faculty at UAMS Family and Preventive Medicine Department. He works in the clinical and hospital settings and is quite familiar with hypertension. And we also have our future doc, who has also chosen family medicine and is currently applying, Hayden Elliott. He's a VP of the Family Medicine Interest Group. And like I said, he's applying to family medicine. So welcome to both of you.
Thank you, Alexa.
Thank you.
So I'm going to start with you, Hayden. Could you tell our audience a little bit about hypertension or high blood pressure as it's commonly referred to?
Sure. So hypertension or high blood pressure, our body's similar to almost like a water system in your house. So you have tubes in your house, your water's under pressure, right? Well, your body, your blood vessels, your arteries and your veins are constantly under pressure. And so when that pressure gets too high, then you start having issues. Just like your water in your house, your faucets and everything start leaking. It's different, a different mechanism in your body, but the result's the same, and then you start having issues. And so it's very important to control that blood pressure. So whenever you go to the doctor's office, you're going to have a cuff put around your arm, and everyone's probably had this done. They blow it up, and they measure it. They measure two numbers. You'll see one over the other. And the top number is the systolic, or when the heart's beating, and the bottom number is the diastolic, where the heart's not beating. And we take those measurements each time, because what we want to check for is to make sure that your blood pressure is within the normal range. You're not at risk of developing any other underlying disease. And if we control that well, then it prevents, down the line, heart attacks, strokes, much worse things. And so it's a very important metric to keep control of. And exercise and walking especially is great for controlling it, which we'll talk about more.
Thank you for that explanation. And on a more personal note, what made you choose family medicine?
I chose family medicine mostly because I like talking to people. I like having relationships with patients and working together to manage their illnesses. And then, like I said before, kind of preventing illnesses is a huge passion of mine. Being able to intervene early on something as easy as blood pressure with something like walking or simple medication has huge impacts on people's lives, and that really interests me. So.
All right, so I think we're going to get to our featured physician for this talk today. As I introduced earlier, Dr. Anil Kaparapu, welcome. And he's going to tell us why hypertension or high blood pressure is such an important topic to talk about. So as I ask, why should we be talking about hypertension, Dr. Kaparapu?
Okay, thank you, Alexa. Thank you very much. And good afternoon, everyone. It's a pleasure to be here with the virtual Walk with the Doc series. Well, hypertension it's like a big thing. It's like a global epidemic. I know we're in the midst of a big pandemic. I think it's even much bigger than any pandemic that we have seen so far. Globally, almost like 1/3 of the population has hypertension. It is responsible for at least 50 to 60% of the strokes, 50 to 60% of heart failures, and 30 to 40% of chronic kidney disease. And at least, 90 million people will die every year due to high blood pressure. It is either directly or indirectly causing such a huge mortality and morbidity. So this is very, very important to control the hypertension. Otherwise, most of the consequences, as I mentioned, heart failure, strokes, and kidney disease will be a very, very bad outcomes.
So I know a lot of patients, when they first get diagnosed, they're kind of scared. They're not really exactly sure what to do. are there things that we can do to prevent hypertension? And if you're diagnosed with hypertension, to kind of help it become better controlled?
Yes, there are a lot of things that you can even prevent. At the same time, if you're in the very early stages, let's say, for example, if you're checking your blood pressure on a regular basis at home, if your systolic, the top number is greater than 130, whereas if your bottom number, diastolic blood pressure, is greater than 80, on multiple occasions, you are having a diagnosis of hypertension. Whereas if you have the numbers a little bit less, let's say the top number between 120 to 129, you have elevated blood pressure, but without hypertension. If your top number is less than 120, that means your blood pressure is normal. You do not have any elevated blood pressure. Whereas for the people who has either normal or elevated blood pressure, there are a lot of things that you can do to prevent hypertension, such as doing a very, very healthy lifestyle modifications. Number one is popularly known as a DASH diet, like dietary approach to stop hypertension. It is nothing but including a lot of fresh fruits, fresh vegetables, making sure that you're cutting down on the salt, making sure that you have a good healthy fats, and a lot of other lifestyle modifications like having a weight loss goal, making sure your BMI is normal range. At the same time, making sure that you're cutting down on the alcohol. Try to avoid smoking if someone is smoking. So all these lifestyle modifications are very, very helpful. If you don't have hypertension, that's good. It will help you prevent. If you do have those, yes, by doing all these, it will definitely improve the blood pressures. Somebody taking 3-4 medications on a regular basis. If they do all this, they may not need all those 3-4 medications. They may just need maybe 1 or 2. So once again, cornerstone of the treatment for hypertension is number one is lifestyle modifications.
So for somebody with blood pressure or high blood pressure, is it safe for them to walk? And is that something that you encourage your patients to do, or other physical activities?
Yes, absolutely. It is actually very essential to do those. It is absolutely safe thing to do. Actually, we highly recommend doing the regular physical activity if somebody has elevated blood pressure or hypertension. A lot of studies has, let's say, for example, American Heart Association, they highly recommend doing at least 150 minutes of moderate strenuous activity every week. So if you put together, it's only like 20-21 minutes per day. It's very easy to think to do. Maybe you could do 10 minutes in the morning, 10 minutes in the evening. It doesn't have to be super strenuous. It's like moderate activity. So just such as brisk walking, or playing a golf or tennis or dancing or whatever your favorite hobbies. Some of you can pick your favorite hobby. It can be swimming or anything. I'm sure you'll get those 150 minutes per week very easily.
And now I know that you see a lot of hypertension in the clinic as well in the hospital.
Yes.
What are some things that you wish people would know more about hypertension or their hypertension that you feel are commonly misunderstood things?
Yes, I think, some patients believe that, it's like a magic pill. I'm taking 2 pills. It's like my magic pill. They think that it's going to get better. Honestly, it's a combination of, I would say, even more of lifestyle changes would do the better job. I have talked to some patients that are actually surprised by just reducing the weight, like let's say on average, it has, equal proportion. If you cut down on, your weight by 1 kilo, your blood pressure will go down by one point. So same as other lifestyle modifications, let's say just doing the DASH diet itself, like cutting down on salt, it will help, to reduce at least 5 to 8 mmHg. Same with other activities, like let's say, for example, if you cut down your alcohol, like men, less than 2 drinks per day, in women, less than 1 drink per day, it almost reduces to 4 to 5 points down. Same with exercise, same with, at the same time, cutting down on the salt, like very, very crucial, less than 2 grams per day has been recommended by most of the organizations. And at the same time, you need to include a good amount of potassium. It doesn't mean that you have to take a potassium pill every day, but make sure you have a good healthy foods that has rich in potassium. It can be avocado or banana or tomato or whatever you like. Same, try to have good fats like good omega-3 fats in your diet. If you, let's say, for example, if you love a lot of meat, maybe try to cut down on the meat, maybe change it to seafood like salmon or something, or good amount of nuts. So trying doing all these lifestyle modifications will definitely help. Sometimes people will be surprised if I put all these numbers together, they'll be surprised.
I think this was really informative. So now to the most important question for you, Dr. Kaparapu, and for you, Hayden. What sort of physical activities do you guys like to do on your own or with your family?
Well, I like to do definitely, a treadmill. I have, my treadmill at home. If the weather is not nice, I try to do it at home. If the weather is good, we have a small lake nearby. So we just go there near the lake. We just walk with our family.
I
What
enjoy
about you, Hayden?
I enjoy doing walking, running, but hiking would probably be where I get most of my steps in, and of course walking around the hospital when I'm following people around.
Great. Well, I appreciate both of you being here with us for this November talk today. I think this is a great time for all of you out there that are listening today to get out, walk with your families, get out there and start moving. Remember to social distance, bring your mask with you so that while you're walking, if you need to be safe, you can. All right. We'll see you next time. Bye.
Thank you, Alexa. Thank you. Bye-bye.
Thank you.
Walking is fun, walking is healthy. Let's walk every day.
Walk with the dog.